Welcome back to Toledo Clinic TV. Joining me now is our special guest, the Chief Administrative Officer, is that correct?
Yes.
Of the Toledo Clinic, Mike DeRamo. You have been in healthcare for quite some time, and I'm sure you've seen a lot of changes.
Yes.
So give me an idea about what we can expect under the Donald Trump administration.
Well, as you might guess, that's going to be difficult to project, especially knowing our new president-elect. Certainty is not something that you can gamble on, but there is some sense that in the new administration that you're probably going to see two themes prevail. One theme will be more of a competitive component, and I think if you look at kind of the three main components of healthcare, the facility or hospital-based component, the physician component, and the insurer segment of healthcare, all three of them will go through some, may I call it, some degree of disruption or turmoil. You know, if you follow stock market trends, one area that's clear is that a number of healthcare executives, mostly on the facility side, i.e. the hospital side, nobody gave money to Donald Trump. And so now the question is, what's going to become of healthcare in the new administration? And almost every major sector of investment is trending upwards, with the exception of healthcare. And I think what you'll see, and again, sheer prognostication on my part, is that you'll see an administration that will have what I would call more of a provider or physician bias. What they found over the last 30 years of what they call integrated delivery. I don't know if you're familiar with that term, but integrated delivery says if you put the hospital, the physician, and the insurance company in one tidy bucket, you're going to get a more efficient delivery of care. And fast forward 30 years later, that necessarily has not been the case. What's really happened is that you've had higher prices. Because in order to do those three things under one giant umbrella, you have to be big enough to pull it off. And in order to be big enough to pull it off, you have to have some monopolistic business environment. So I think what you'll see is a Trump administration that's going to encourage more competition. And they'll, you know, we've heard talk of bringing out-of-state insurance policies, which has its own hurdles, but bringing more insurance to, for instance, the Toledo market will, in theory, drive down costs because you have more competition. I think you'll see a repeal of physicians' capacity to own and build hospitals, which has been essentially illegal for physicians to build hospitals since the advent of the Affordable Care Act. So I see that kind of disruption in the next 3 to 5 years.
So we'll see changes, I think, on both sides. One, the consumer is going to see some changes,
yes,
good or bad, and then the physician and the hospital industry will see changes as well.
Yes, yes, and if you're a consultant, change is good because disruption is great for consultants. But you certainly are not going to see the status quo, and you certainly, and I think some leadership from Mercy Health commented on this last week. The future is not in buildings. So you're not going to see the grand buildings, the big, now ironic under a Trump administration, mind you, but nonetheless the facility-centric delivery of care really has proven to be an expensive way to deliver care. And because you have to fill the building, you have to support the building, and even though it makes sense to centralize services under one giant roof, patients' access to that large building component is really not an effective way to deliver care in the modern era.
So breaking things down to the most basic level, are patients going to see an improvement in healthcare or not necessarily?
It depends on who you are. If you have access, if you're mobile, and you have options, the ability to take advantage of options, I think you'll see more options in the delivery of care. If you're in a situation where you don't have a lot of options, either due to limitations of income or limitations of mobility, you may see more restrictions. So like any other healthcare administration, I'm afraid there'll be winners and losers.
Okay. Well, we will stay tuned to find out how that all shakes out.
Yes. Yes.
All right, thank you so much. And we will be right back.